The risk for potentially preventable hospitalizations are substantially higher among people with vision and dual sensory impairment, and annual wellness visits can reduce that risk by almost half. My name is Elham Mahmoudi, and I'm an associate professor of health economics in the Department of Family Medicine at the University of Michigan Medical School in Ann Arbor. The full title of this article is Potentially Preventable Hospitalizations Among People with Hearing, Vision, and Dual Sensory Impairment, a Case and Control Study. Potentially preventable hospitalizations are hospitalizations that could have been avoided if patient had timely access to care. These hospitalizations are expensive. Usually they don't add any value, and in fact, they may increase the risk of harm to patients by increasing the risk of infections, falls, and other hospital complications. Our team has done extensive work on identifying, for short, PPH risk or potentially preventable hospitalizations risk. We know that vulnerable populations with higher comorbid conditions, older adults, people with disabilities, people with dementia, and those who live in disadvantaged areas with fewer primary care physicians are at high risk of PPH. In this study, we used Medicare claims data, which is health insurance for older adults, to compare the risk between people with sensory loss and those without. Not surprisingly, people with sensory loss are older and have higher comorbid conditions. What was surprising was the fact that despite their higher needs, they use fewer preventative care services. One important modifiable factor that we found in our study and our prior work is the use of annual wellness visits. Since the implementation of Affordable Care Act since 2010, annual wellness visits are free of charge. There's no out-of-pockets to patients. Think of them as an opportunity to go visit your primary care physicians to do a complete checkup. That would reduce your risk of adverse health events or going to hospitals when you don't need it. Only a small fraction of patients in general use annual wellness visits, and that percentage is substantially lower for people with sensory loss. We do need to do a better job encouraging or incentivizing patients, especially vulnerable populations, to take advantage of these visits. On behalf of the co-authors and myself, we would like to thank you and invite you to read the full articles. It will be published in the Journal of Mayo Clinic Proceeding, Innovations, Quality, and Outcomes. Thank you.